You just received your blood test results, and you don't understand any of these numbers. But in reality, you only need to look at 3 things, and you can already know whether there is something wrong in your body. Doctors don't read every single line separately. They read it using logic. This video will help you. Look at a complete blood count and immediately understand what is happening in your body. Part 1. How to read a blood test. When looking at a blood test, doctors do not read it line by line. They only try to answer 3 questions. Is there anemia? Is there an infection? Is there a risk of bleeding? Part 2. How to read red blood cells. We start with 3 indicators: RBC, hemoglobin HB, hematocrit HCT. Hemoglobin is the most important. Anemia is defined as below 130 grams per liter in men, below 120 grams per liter in women. This is the key deciding value, not RBC, not HCT. RBC is the red blood cell count. It increases in blood concentration, chronic low oxygen. It decreases in anemia, blood loss, bone marrow failure. Hematocrit is the volume of red blood cell mass. But hematocrit can be affected by fluid infusion, so it is not as reliable as hemoglobin. That is why when reading a blood test, you should look at hemoglobin first, instead of getting confused by RBC and HCT. Part 3. Classifying anemia. This is the most important part. Once anemia is confirmed, we look at 3 values: MCV, MCH, MCHC. Start with MCV. You can identify the cause of anemia in just a few seconds. MCV is the mean corpuscular volume of red blood cells. It is used to determine whether red blood cells are small or large. Low MCV is seen in iron deficiency anemia and thalassemia. High MCV is seen in vitamin B12 or folate deficiency. Chronic disease anemia usually has normal or slightly low MCV. MCH is the average hemoglobin content in each red blood cell. Low MCH means hypochromic red blood cells. Normal MCH means normochromic red blood cells. High MCH has less standalone meaning and must be interpreted with MCV and MCHC. MCHC is the concentration of hemoglobin in red blood cells. It is used less often, but helps confirm red blood cell quality. RDW is the variation in red blood cell size distribution. RDW above 15% means red blood cells vary in size. Seen in iron deficiency, hemoglobin disorders. Quick summary. Small red blood cell anemia is usually due to iron deficiency. Large red blood cell anemia is usually due to vitamin deficiency. Part 4. White blood cells. WBC is the white blood cell count. Normal range is 4 to 10 grams per liter. Increase usually suggests inflammation or infection. Decrease may suggest bone marrow failure or viral infection. But WBC alone does not say much. What matters is which type is increasing. Neutrophils. Increase in acute bacterial infection, such as pneumonia, appendicitis, abscess. Decrease may indicate severe conditions such as bone marrow failure or severe infection. Lymphocytes. Increase is commonly seen in viral infections or chronic infections such as tuberculosis or hepatitis. Decrease occurs in acute infection or immune suppression. Eosinophils. Increase in parasitic infection or allergy. Quick rule: high eosinophils suggest parasites. Monocytes. Increase in chronic infection. If monocytes and lymphocytes are both increased, it suggests a long-lasting condition. Basophils. Very rare. Increase in allergy, bone marrow disease, immature granulocytes IG. Some analyzers report this value. Normally, it is almost absent. If IG is elevated, it means the body is releasing white blood cells early to fight severe infection. White blood cell summary. Neutrophil increase suggests bacterial infection. Lymphocyte increase suggests viral infection. Eosinophil increase suggests parasites. Part 5. Platelets. PLT is the platelet count. Normal range is 150 to 400 grams per liter. Low. Risk of bleeding. Causes: bone marrow failure, dengue infection, immune destruction. High can be caused by inflammation, cancer. After spleen removal, MPV is platelet volume. Large platelets are young platelets. Small platelets suggest reduced production. PDW is platelet distribution width. Above 15% means platelets are not uniform in size. Part 6. 30-second reading method. Step 1. Look at hemoglobin for anemia. Step 2. Look at MCV to identify anemia type. Step 3. Look at WBC for infection. Step 4. Look at neutrophils and lymphocytes to distinguish bacteria or virus. Step 5. Look at platelets for bleeding risk. Part 7. Real cases. Now try to read it. Case 1. What type of anemia? A patient comes with fatigue and dizziness. Results show low HB, low MCV, low MCH. Just by these 3 values. You can identify microcytic hypochromic anemia. In real practice, this is usually iron deficiency anemia. This is the most common anemia type in clinical practice. Case 2. Fever bacteria or virus. A patient has high fever. WBC is high, but lymphocytes are higher than neutrophils. This does not match typical bacterial infection and suggests viral infection. High WBC does not always mean bacteria. Case 3. Low white cells and platelets. A patient has mild fever and body pain. WBC is low. Platelets are low. This pattern is commonly seen in dengue, but not only dengue. Chronic liver disease or cirrhosis can also cause it. Remember, a single test is not enough for diagnosis. It only guides further steps. Case 4. Serious but easy to miss. A patient has severe fatigue. HB is low. WBC is low. Platelets are low. This is no longer simple anemia. All 3 blood cell lines are reduced. This is usually a problem in blood production. In the bone marrow, when HB, WBC, and PLT are all low, this is a serious warning sign. Consider bone marrow disease such as aplastic anemia or other blood disorders. Final message. You see it now. Just a few lab values. And you can read the story behind them. That is how doctors read blood tests. It is not just numbers. It is a warning from the body, often before symptoms appear. Ignore it, and you may miss an early stage. Anemia, infection, bleeding, risk. If you know how to read it, you understand your body in 30 seconds. Now try it. Open your own blood test and see how much you can understand. Thank you for watching. Don't forget to like and subscribe to the channel. Check out my other videos to learn more useful tips about medicine and health.